Good afternoon, everybody. My name is Pete Dixon. I'm a researcher within the North West Coast, and I'd like to welcome you to the Care and Health Informatics theme update for this ARCFEST. Our presentation will consist of 4 pre-recorded presentations. The first will be by our theme lead, Professor Sarah Rogers, who will be talking about an application for a project called Groundswell. Now, Groundswell is looking at how towns and cities can maximise the contribution of their urban, green and blue space towards improving population health. You'll notice there it says watch this space. That's because this is an application, but we're hoping in the next 1 to 2 weeks that an announcement will be made as to whether this has been successful for funding. So do keep an eye out on our social media feeds if you use that, and our website. There then follows presentations from 2 of our PhD students. Alexander Delia will be speaking about artificial intelligence and inequalities in healthcare. And then Piotr Todorovsky will be talking about the start of his PhD project, which is looking at public involvement and engagement of seldom heard communities in big data research. Finally, Dawn Allen will be having a chat to myself about her experience of being a co-lead within the theme. We do have other projects ongoing. We've started looking at some stroke data for the North West Coast Stroke Roundtable. We're continuing to engage with local civic data cooperative. We've got a project going on looking at prescribing of anticholinergic medication. You should hopefully be able to hear an update on those and others in our next ARCFEST in September. Now, before we move on to the presentations, I'd just like to flag up one thing, and that is the fact that we have vacancies open for a public advisor deputy co-lead, as well as a co-lead and deputy co-lead from our member organisations. Now, these are very important to us. This allows us to see that we are addressing the priorities of our local communities and our local providers. That allows us to embed co-production and public engagement at all steps within our theme and all the work programmes and projects that we have going on. If you are interested, we really want to hear from you. If you maybe got some questions before you want to bite the bullet and actually apply, please do get in touch. You can email Sian Guy, our theme administrator. Her email address is there. There's also information on this in our web pages, the KAI web pages of the North West Coast website. But please do get in touch if you are interested. We'd love to hear from you. Hopefully Dawn's chat with me will make some of you want to apply. So I think that's, as you'll agree, enough of my dulcet tones for the moment. So without further ado, we shall move on to our first presentation, which is from our theme lead, Sarah Rogers.
Today, I'd like to tell you about our proposed Prevention Research Partnership Consortium. Groundswell is a transdisciplinary consortium co-led by 3 directors based in our 3 pioneer cities, Belfast, Edinburgh and Liverpool. Each has a specific area of expertise, systems, co-production and data, allowing us to delve deeply into how our towns and cities can maximise the contribution of urban, green and blue spaces for population health, with multiple industry, policy and practice partners capable of delivering change at scale. The current pandemic is a stark reminder of humanity placing too many pressures on nature, and these have damaging consequences. Urban Green and Blue Space offers an ideal exemplar for testing innovations, as it has both place-based and whole society potential to reduce the health burden of NCDs, non-communicable diseases such as heart attacks and mental health, and communicable disease and inequalities. There's compelling evidence that these spaces impact multiple behavioural and environmental pathways. There are numerous physical and mental health benefits of spending time in our green and blue spaces, and the COVID pandemic certainly highlighted access inequalities to parks, for instance, for our deprived urban communities. Few other, if any, policies can contribute to the reduction of numerous NCDs and their risk factors. We know that the urban spaces we have are not those that we need to make the best possible contribution to better and more equal health. Groundswell will change that. Groundswell will transform systems so that our spaces are planned, co-planned, developed, implemented, maintained and evaluated using parallel innovations in community engagement and data-informed adaptive systems. So we argue that green and blue spaces should be equal to other key provisioning systems in cities, such as shelter, food and water. This was supported by discussions with low-income communities and policy and practice partners during our consortium development webinars. Urban green and blue spaces are free at the point of access, a critical aspect. They're equigenic. We'll have the ability to evidence the long-term health and wider economic impacts of harms due to the lack of quality spaces, allowing our communities to raise the importance of these spaces forever. This will prevent selling off land and building homes so densely that further generations aren't sentenced to high risk factors and debilitating NCDs. Groundswell outputs will mean our children have the best start in life. They'll have enough outside space to be active and greenery to make them feel good, all while promoting social cohesion across all ages. Inequalities in childhood drive the ever-increasing burden of chronic disease and social problems in adulthood. This is staggeringly expensive. Conservative estimates place the annual cost of inequalities over the life course at £60 billion in the UK alone, and Groundswell will make a significant contribution to reducing these future costs. So I'll mention more about data here because this is my area of expertise and that of several ARC colleagues who are also part of the Groundswell team. We'll collate all the data for the whole project and liaise with our data experts in Belfast and Edinburgh too. We have a wealth of experience in using the most sensitive types of health data as well as other types of data. We've done this before and we have policy, practice and industry partners to help, as well as an ethics and data oversight committee. So we'll collect some types of data directly from our citizen scientists. Ideally, everyone here will download our app to record which types of spaces you visit and how you feel while you're in them. This will be a big help, especially if you consent to link these data to other data that are routinely recorded about you, such as the number of visits to your GP or why you were admitted to hospital. We can use routine health data and behaviour data to evaluate the impact of existing and new spaces. We can look at prescriptions for mental health and gauge the amount of walking, cycling or simply sitting and enjoying these spaces, using these as preventative factors for serious health conditions in the future. By generating robust evidence and making it accessible to everyone, we hope our cities will advocate for the spaces that are most beneficial for our populations, who previously probably didn't use the spaces and were most likely to develop conditions that need medical treatment. Groundswell will identify the levers we need to pull to co-create systems transformations to prevent NCDs for those who need it the most. We'll have 7 interconnected work packages. First, we'll develop with our stakeholders a systems-oriented framework to better understand how urban green and blue spaces impact NCDs and inequalities, and that will underpin the whole of Groundswell. The conceptual framework is brought to life by agent-based modelling, working with stakeholders to simulate how space transformation will reduce inequalities. We're working with communities and stakeholders to co-develop and evaluate interventions using citizen science approaches, such as the app. All work packages are supported by data innovation, with ongoing green and blue changes linked to health indicators at multiple scales to inform and evaluate interventions. The economic costs and consequences of our work are considered in Work Package 5, and identification of systems level actions to improve our decision making in Work Package 6, while Work Package 7 is dedicated to ensuring Groundswell has impact. And we've got a golden thread of health inequalities running through all work packages as a dedicated theme. The steps we'll take to ensure we do have really beneficial impact are here on the left. For example, we'll have an ambassador programme to train our community advocates, and we'll have UK-wide impact via roadshows to named follower case study cities. During the next 5 years, Groundswell will ensure that communities are equal partners in the research process, better able to inform action and innovate on health inequalities and NCDs. So maximising the health benefits. We will empower our communities. We will have beneficial impacts on well-being and physical activity and have robust analyses using real and simulated data, evidencing cost effectiveness. And we will have ensured policies across different sectors have NCD prevention as clear shared priorities in our 3 pioneer cities. We expect to achieve visible reductions in health inequalities in NCDs in our pioneer cities within 5 years for wellbeing and mental health and risk factors such as physical activity. will build a momentum and a critical mass so we are the place to come for spatial policy development, ensuring our communities and other systems are self-sustaining and adopted nationwide, allowing us to evidence reductions in the longer term. We'll have an entire work package dedicated to co-production, with almost a third of our budget dedicated to this. Our training academy will build capacity ensuring long-term impact, and our 11 PhD studentships leveraged from our universities will help develop interdisciplinary skills. We even have a community journalist involved. Research staff and students will undertake internships with partner organisations acting as knowledge brokers and providing them and us with real-world insights, and help generate effectively designed evaluations so that cities are assisted in producing robust evidence of what works for them and why. We received some funding to develop our ideas with partners, and we did a lot of work last year before submitting our proposal in December. Team science training helped us develop a shared vision and language. Systems thinking workshops with our partners applied a systems lens to the development of Groundswell and helped us produce a coherent and integrated research programme with community conversations where we co-produce priorities. I also highlight here the £2 million of leveraged and in-kind support, including £500,000 from the Public Health Agency in Northern Ireland. That's about 30% of our total requested budget, showing the readiness of our regions and how welcome our approach is to local policymakers and practitioners who have agreed to support us and host Groundswell researchers. So we'll do all the things on this slide, and so elevate urban green and blue spaces equal to shelter and sanitation, rebalancing our relationship with nature to protect against future pandemics. By investing in these spaces, additional benefits, food creation, biodiversity, coincide with health benefits. Realising these requires a shift in the balance of decision-making to place weight on protecting, enhancing and providing more appropriate green spaces designed with local communities. Current economic recovery programmes are a timely opportunity, and we need Groundswell to find the best levers to protect and restore nature, tackle climate change and health inequities altogether. So this is why Groundswell is a timely consortium worthy of funding and support, and we hope to hear soon about the outcome, and people should keep an eye on the ARC website and Twitter feeds for updates in the next few weeks. Thank you very much for your attention today, and hope to see you all soon. Bye-bye.
Hi, my name is Alexander Delia, and I am a PhD student at the Institute of Population Health Sciences in Liverpool. I'm supervised by Lucy Fripp, Mark Abbey and Sarah Rogers, and started my PhD in February, so quite recently, on artificial intelligence and inequalities in healthcare, and I'll run it through very quickly here. So, quick background, AI is, as you may know, being implemented all across society. Lots of hype, but also lots of potential in healthcare. One can imagine it being useful in data analysis, big data research, finding new drugs, etc., optimizing processes, but also to actually provide care and in some settings replace healthcare professionals such as nurses or doctors. I have chosen to focus this project on healthcare inequality, and not just health inequality, just to narrow it down a bit, along the axes of socioeconomy, ethnicity, and gender, which all interact. The mechanisms for the genesis of the inequalities are similar, and the approach is to mitigate them as well. So, quick about the actual project. I will be using a realist evaluation approach to analyzing this topic, which is originally developed as a way of analyzing complex healthcare or social interventions, focusing more on what works for who and why than the actual outcomes it's used to find the connections within a system and figure out what works for who and why, essentially. The basic idea is to start by creating a conceptual framework from scoping, going on to collecting data around that framework, doing a thematic, qualitative or quantitative analysis and looking at how the different themes in the framework interact, and then modify the framework to have a more detailed and correct understanding of the system. So without further ado, this is my provisional framework. It's a bit overwhelming and I won't have time to go through it in detail, but essentially start out here on the left, social, class, ethnicity, gender, affecting intermediate determinants of health in the society, creating baseline health inequalities, entering healthcare system here, going through the healthcare system, access, uptake, adherence, effectiveness of interventions, and then creating inequalities in healthcare. I've divided in the AI effects on intrinsic into intrinsic and extrinsic effect, where intrinsic is mostly data things, such as the algorithms in AI being inadvertently racist or classist or sexist due to underlying biases in the data sets. So that's one side, and the other side is extrinsic effects. So with that, I mean what's actually happening in the interaction between the patient and the healthcare system. So I've come up with these 6 different themes with positive and negative potential effects on equality. So from this framework, I will then conduct an interview study. This is part of the realist evaluation ID. But the question then is, how do you evaluate something that doesn't quite exist yet? So the interview study was one way of exploring this further. So I want to interview stakeholders at different levels of the framework. So essentially levels of the theory of change of AI and health inequality. So I want to talk to developers, I want to talk to policymakers, I want to talk to healthcare providers, doctors and nurses, and also patients to kind of capture as much as possible of it. And do semi-structured interviews based on my framework and hypothetical scenarios, such as you have a diabetes patient in the future where the doctor will be replaced by an AI for 50% of the consultations. How do you think this will affect these different themes and by extension inequalities in health? I will then use the data from that, do a thematic analysis, look for how different themes connect and modify my framework. So again, this is early days and it's a bit loose at the moment, but I'm working on the methodology and I'm confident that something interesting will come out of this in the end. I welcome all kinds of input, positive and negative, and collaborations, and I thank you for listening. Have a nice day.
Hi, good afternoon. I'm Piotr Todorovsky, PhD student funded by ARC and based at the University of Liverpool. And today I'm going to give you a short overview of my PhD project. If you'd like to get in touch with me, I'm active on Twitter, or alternative, you can drop me an email. So my PhD project aims to explore how researchers can improve public involvement and engagement of certain health communities, and here I'm especially focusing on the migrants and ethnic minorities in big data research design and governance. So why is it important? Well, first of all, the public is concerned about how the data is shared, with whom, and where it's being stored. And what we know from our experience is that, first of all, based on the CARE data project, that without public support, big data projects cannot succeed. And any particular focus of any public involvement and engagement should be to include certain heard voices. Ignoring them can make findings ungenerously able to all parts of society and miss new ones specific to those groups. So my PhD consists of the 3 different research projects. First of all, I'm going to conduct the scoping and systematic reviews of the literature. Then I'm going to explore the public engagement campaign on the Twitter, and finally conduct the qualitative study with South Asian and Polish communities in the UK, as well as researchers and public involvement engagement facilitators, trying to get a grasp of how we can engage with the certain health communities. Today, during the presentation, I'm going to mention and talk more about the study 2 and 3. So some of you might have heard about Data Saves Lives campaign, which has been launched in the UK a couple of years ago, and nowadays has been expanded all around Europe. The campaign aims really to show the benefits of using the big data for research and how it can improve the healthcare. So really, I tried to collect tweets over the period of the 3 months to explore the character and the role of the campaign online. At the same time, I tried to see what are Twitterers' views towards the big data research in the healthcare setting, those obviously who use that particular hashtag. It's going to be mostly qualitative analysis of the tweets published on the social media. The other study is going to explore public involvement and engagement of certain health communities in big data research. So here I hope to conduct semi-structured interviews with the Polish, South Asians, and researchers. So first of all, with the South Asian and Polish as a participants, I'm especially keen to talk with those who haven't involved or engaged in the previous research projects on public and engagement involvement activities, really, because what part of my PhD is really to help researchers to reach especially those communities, so we can understand their neighbors and barriers in involving and engaging them in the research. So then at the same time, I try to explore how researchers could involve lay public members in the design and governance of big data research. And here I'm especially keen to talk to researchers who already have experience of reaching those communities, but not say limited here only to South Asian and Polish. I also would like to mention here and say a big thank you to public advisors involved in my project, Sakwe and Nahid, the co-authors of the protocol review, which is currently we are submitting the minor revisions to the journal. And they also assisted with the design of the qualitative study and would be involved in the co-production of results for qualitative study. So going to support the analysis of the interviews, which I think is a key for my PhD work to get that angle and the perspective, especially coming from the seldom heard communities. So like, again, a big thank you to them. So thank you again for listening. And if you have any questions, I'm happy to answer them. As well, feel free to drop me an email or tweet to me. Thank you again for listening.
Hi, Dawn, how are you?
I'm good, thank you. Are you?
Yeah, fine, thanks, fine. Thank you very much for agreeing to have this little chat. I know you can't actually be with us on the day of the ARCFEST, so thanks for agreeing to this about your chat about your experience of being a co-lead on our theme. I'd just like you to introduce yourself, a bit about yourself and why you were interested in applying for the ARC Northwest Coast co-lead and especially within our theme.
Yeah, well, I'd been an active public advisor for about 2 years, and I was involved in community projects, neighbourhood community project, looking at the barriers to people being able to access public transport. And before then, I was involved in various roles as a public contributor at the University of Manchester, mainly around mental health research. As my background had been, I was a carer for my mum and became involved in helping change and improve services using lived experience as a carer, and yeah, just became more involved in that. When I saw this post advertised, I thought it would be a great opportunity to get a bit more involved in bridging that gap between the general public and research planning, and being involved in a specific area of you know, people being able to access data and teams being able to access data. So it was you know, something that was a bit new to me because I didn't know a lot about data, but I was interested in health inequalities, you know, trying to get communities involved in being able to participate in research. And yeah, that's kind of where I started from, really.
That's great. That's great. So it's been really useful having you join the team, and I know you're still quite new. You've been attending our our theme meetings and helping us sort of prioritise the projects and understand what's going on within the theme. Have you had any training so far, or is there any training you're looking forward to receiving?
At the moment, I've been getting involved in some of the training. So we've had sort of general team working training. So we've been meeting as a group of co-leads and deputies. So that's been quite interesting because we've been able to look at our skills and what kind of sort of, you know, where we are within a group of people and we're working together. So that's been really interesting. We've also been looking at things around using sort of digital platforms, how you might communicate with different groups, how you might communicate virtually between the team. And I know it'd be really useful to have a bit more of a sort of an opportunity to look at the ethics of data and data confidentiality, a bit more of a sort of in-depth understanding about data from what I already sort of know and have experience with you know, other stuff that I've been doing at the moment. So yeah, it'd be a bit more training. Yeah,
I think that's great. Yeah, I think that data confidentiality is a big thing within sort of big data health research. People are quite sometimes wary, sometimes rightly, sometimes wrongly about their the use of the data. There needs to be, I think, a greater understanding of how the data is anonymized and that it's safe to use. And I think having more and more people who are general members of the public to understand that and help spread that message out will be really useful for the team and also for yourself. Are there any particular areas of healthcare and the health sort of system that you're interested in finding out more about, or helping shape the theme towards doing a bit more research in those areas?
Well, I spent quite a number of years involved in peer support for people with mental health challenges, and I think understanding a bit more about how data can maybe improve sort of frontline care, therapy, different ways in which communities can be structured to enable people to sort of get more out of the life and so on. So I think for me, I kind of become involved in public involvement from a mental health angle, and obviously my voluntary work as well. You know, this kind of was like a little bit of a sort of an area where I was really interested in looking at, because it was, as I said earlier, around being able to know a bit more about sort of data and how it can be accessible to communities. So that's you know, anything that's related to mental health care would be something that I would really like to sort of focus on.
That's great. That's great. That'd be a really interesting area to explore, and I know there's a lot of people, certainly, you know, on the team already, and probably on the ARCFEST today watching this who would be interested in that as well. I think we are looking for a deputy co-lead, a public advisor co-lead to work alongside yourself. It's been really useful to have you on the team and join us and help us steer in the right direction and give us this sort of voice from the community side of things. So you got any words of encouragement for anyone who's thinking of applying?
Yeah, well, I think you know, everyone's a great team here, and I think you know, if anyone's got any questions about sort of my experiences from my sort of perspective and what I've been involved in before and sort of my recent experience of being involved in this theme, then yeah, I think, you know, just get in touch with the information at the end of this recording, and yeah, just ask any questions if anybody wants that sort of conversation around, you know, how they could get involved and whether they feel that it will be worth applying and so on. But it's very you know, it's very informal, and you know, it's an interesting thing to do alongside any other things that you're doing at the moment in your life. So I think yeah, hopefully we'll get a lot more people on board. So
cheers, thank you very much. So thank you for taking some time out today and answering these questions. And hopefully you may have some people interested in getting in touch with you in due course. Yeah. Cheers. Thanks a lot, Dawn. Bye-bye.
Bye.